Hello and welcome to African American Health Matters.
This is Ed and Pat Sanders with health tips and information because your health does matter. The information in this broadcast is not intended to substitute for personal medical advice. Now, before making any decision about your health, please consult a physician or a qualified healthcare professional.
Staying fit and healthy usually takes a back seat for most people. And for many African Americans, staying true to tradition and keeping it healthy often don't go together. With the cold and flu season, overeating and eating the wrong foods can set you back to the point where you feel like, oh my goodness, what's the use?
Well, there are critical numbers of African Americans dying from prostate, breast, lung, and colon cancer, but a lot of times it's treated too late. Now, even more African Americans are affected by diabetes, hypertension, asthma, high cholesterol, obesity, drugs, and alcohol.
And we're still needing continuing education and more information about HIV and AIDS. Our surveys show that we need more ways to access resources available in our community.
Yes, and Papa, do you know what? There's a staggering number of African Americans who are not aware of drug discoveries that could save their lives through clinical trials. What we need to do is educate more people about the importance of clinical trials.
I agree completely. Drugs that can be used on African Americans and tested in Africa, Brazil, or Jamaica is just not going to cut it. Rather than letting other countries test medicines that will be administered to us, we as African Americans need to have a say in the drugs that will be put in our bodies. And the only way to do this is to participate in new drug discoveries.
That's right. And we have with us today Dr. James Powell. He's going to talk more about this, but in the meantime, let's tell them about African American Health Matters.
Well, African American Health Matters is a new mobile health text message and multimedia outreach that gives health tips and reminders to our subscribers right over their cell phones.
Yes, it actually gives them their health tips for things like remembering to take your medication, tips on handling diabetes, hypertension, losing weight, and also breaking all those bad habits.
Now, you can register online and get health text messages on your cell phone by going to www.africanamericanhealthmatters.com, or you can call our 800 number, which is 1-800-677-8441. That's 1-800-677-8441, and somebody will get back to you probably within 24 hours to get you registered.
Now, you know, African American Health Matters kicked off a little over a year ago as part of the National Physician and Family Referral Project. It's known as NPFR, and it is a division of 50 Hoops. Now, you can find us on www.50hoops.org. 50 Hoops is the only national prostate cancer tournament in the country, and it's true at 15 cities across the U.S., educating men all about prostate cancer.
Yeah, well, we know that you, having played professional basketball overseas, that 50 Hoops is your baby.
Yes, but what the NPR division does is just as important.
You're right, because like 50 Hoops, NPFR programs like Prostate and Colon Cancer Breakfast, our fabulous 50 to Sexy at 60 dinner lecture series, has had rave reviews around the country because they educate people about the diseases and about clinical trials. And you can see more about NPFR on www.npfrproject.org. Now, Ed, you know, racial disparities in healthcare for African Americans and other minorities, including underserved, is very high. And that's why we're so happy to have great partners within our African American Health Matters.
You're absolutely right. And each week we want to recognize and thank all of them.
Who are some we're going to be featuring in the coming shows?
Well, we've got American Lung Association, Colon Cancer Alliance, Patient Advocate Foundation, National Foundation for Continence, Susan G. Komen Foundation,
Right, yeah.
Us Too, National Headache Foundation, and also the Obesity Action Coalition, just to name a few.
And all of our partners take part in our radio broadcast over the coming weeks, and we hope that their messages will help our audience live healthier lives through our tips.
Well, let's move on to some of the African American health tips.
Okay, let's go.
Diabetes. You need to eat about the same amount of food the same time each day to keep your blood sugar at healthy levels. This is from www.lifescript.com.
And here's one for hypertension. Eat plenty of fruits, vegetables, and low-fat dairy products this holiday. Watch your fats. Now, this is from African American Community Health Advisory, which is also one of our partners. It sounds like common sense, but with the holidays, you know, we all want to eat lots of pies and cakes and vegetables loaded with butter, oil, and pork. We as a nation, as well as we as an African American race, we've got to change our ways.
Yes, and atrial fibrillation, also called heart palpitation, heart flutters, or AFib, falls in that same watch out category. This means watch out for alcohol, cough syrups, and other stimulants that might encourage heart palpitations. This comes from www.mothernature.com.
Here's another tip from mothernature.com. It's for colon cancer. Broccoli, spinach, and low-fat dairy products bind to potentially colon cancer-causing agents and escorts them out of your body. In short, remember, eat your vegetables. Raw is, of course, better, but try to cut down on the oils or skip the oils and the butters and some of the animal fat.
And from one of our partners, the Colon Cancer Alliance, that the number one factor for colon cancer is age. Are you 45 or older? Go to www.screenmycolon.org.
We'll have more tips from our partners later in the program. Now, let's take a listen to this message from one of our partners.
25 million Americans suffer from bladder control problems, and they are not all women. Yes, it might be an embarrassing subject, but too few people seek diagnosis and treatment. People fear that no one else is experiencing what they're experiencing, so they don't mention it to their doctor. Too few African American men are aware of what their bladder and prostate health needs are, the symptoms of problems, and how to talk to their doctor.
Over 200,000 men will be diagnosed with prostate cancer this year, and a disproportionate number of these men will be African American. Prostate cancer is the second leading cause of cancer death in African American men, and they are 2.5 times more likely to die from this disease than Caucasian men. Fear of a leaky bladder or loss of sexual vitality stemming from cancer treatment should not keep men from getting diagnosed early to improve their outcomes. There are solutions and resources to help you combat any negative side effects of treatment.
Many people think that bladder and bowel control problems are something that just affects older people, and nothing could really be further from the truth. They can affect a broad spectrum of people of both genders and all ages. African American men are particularly vulnerable on a variety of fronts. For example,
men in their 50s and 60s with an enlarged prostate or men who've had prostate cancer surgery can experience urinary problems like retention or leakage. People with MS and Parkinson's disease, stroke survivors, or people with spinal cord injuries from sports or motorcycle accidents can have bladder and bowel control problems. Signs of such problems are usually the urgent need to get to the bathroom with little warning. African Americans are at a greater risk for developing type 2 diabetes. One of the early warning signs of diabetes is urinary frequency, and in later stages of diabetes, nerve damage could cause problems.
the point is that many of us have bladder control problems. The aging process is just one risk factor that we all face.
The first and most important thing to do is to get educated. Learn about the treatments available and learn the words to describe your problem so that you can talk to your doctor. The best place to get educated is NAFC, the National Association for Continence. There's a great website where you can read all of this information and more. You can even find an expert near your home. There's a lot of help out there, and you just need to get started. Visit nafc.org or call 1-800-BLADDER for help.
We talked earlier about NPFR's Fabulous 50 to Sexy at 60. Well, we recently had a Fabulous 50 lecture at Bishop T.D. Jakes' landmark church, the Potter's House. It was a prostate and colon cancer 101 lecture series. And Esther Davis, a #1 rated syndicated Esther Davis show that airs on Ion Media channels 68 and 42, was our host. And we were so very excited to have her there.
And one of the speakers was Dr. Rufus Green, noted urologist of Urology Institute of Dallas, who talked about prostate cancer.
Thank you so much for getting us all together all the time. Now, Dr. Green, and I'm sure you will enjoy his presentation.
Good evening, and I'd like to say thanks to Ed and Pat for having me out, for the sponsors, and for all of you coming out to be actively involved in prostate cancer. Prostate cancer still is the #1 cause of cancer in men. It's a men's cancer. So for men over the age of 60, it's the #1 cancer, more than colon, more than lung. And so when you think of prostate, think of men, and think of that being the man's cancer. We still see lots of prostate cancer, about 200,000 cases a year. About 30,000 men die from prostate cancer each year. African Americans have the highest rate of prostate cancer. We're twice as prevalent in terms of our non-black counterparts in terms of prostate cancer incidence. Prostate cancer also is increased in families. If you have a family member, first generation, that increases your incidence of prostate cancer by 1.6. So the message here tonight is to do what you're doing, because the good news about this is that if we pick up prostate cancer early and it's still localized, we can usually cure prostate cancer. So that's the good news. So the message is that how do you pick up prostate cancer early? By coming for your screenings each year. It's recommended nationally by the National Cancer Institute that you be screened for prostate cancer with a digital rectal exam and a PSA, which is a blood test that screens for prostate cancer at the age of 40 if you're at high risk, increased risk, and African Americans fit into that group, or if you have a family member that has prostate cancer. Everyone should be tested at age 50 and beyond. The test is done simply with a digital rectal examination. It's a 30-second exam in the office. Also the PSA test, which is a blood test. And we put those two together, and that's the best we have. You hear a lot of talk about PSA. It's not 100%, it's 60%, 70%, 80%. It's the best we have right now. And we've done a lot of things to increase the utility of the PSA. So we don't just take an absolute PSA test. We'll take a PSA and look at the change over a period of time, which we refer to as velocity. We'll look at PSA in relation to the size of the prostate, PSA density. And so looking at doubling times, velocity changes, size of prostate, that helps us improve the detectability of prostate cancer. Now, prostate cancer, people ask, well, what's a prostate? Why do you have a prostate? A prostate is a reproductive structure, knowing about the size of a walnut. You need a prostate to have children. You do not need a prostate to live. So you can live without a prostate. It's sort of analogous to a lady with a uterus. You can have a hysterectomy and do well and not need it for life, but you need it for reproduction. But the prostate cancer, again, is a vulnerable organ. And as you get more senior, one thing that we can say, the older you get, the more your risk for prostate cancer. Prostate cancer is highest among Europeans and lowest among Asians. And again, it's higher in African Americans. So again, the good news is that if we detect it early with digital rectal examination, PSA test, and we can catch it when it's still localized to the prostate, we can cure prostate cancer 95% of the time. So how does it present? A lot of people think there are big symptoms when you have prostate cancer. In fact, the majority of the cancers present and there are no symptoms. Some of the symptoms that you have are the routine symptoms that you have with an enlarged prostate that causes bladder outlet obstruction, difficulty urinating. The majority of the time, that's not due to prostate cancer. That's due to just an enlarging prostate. Now, you can certainly have an enlarged prostate with cancer in it, but there's no big symptoms. Do you have bleeding, blood in the urine? That occurs in advanced prostate cancer, not in early prostate cancer. So there are not any unique symptoms that are different from an enlarged prostate, that the prostate sits right at the base of the bladder where the urine comes out. So if it grows, it narrows that channel, makes it more difficult to urinate, but that doesn't mean you have prostate cancer. Having an elevated PSA does not mean that you have prostate cancer. It just means take a closer look. The PSA is a screening test which we're trying to select out patients that are at risk for prostate cancer, because you need tissue diagnosis to make a diagnosis of prostate cancer. That has to be done with a biopsy, and that's done in the office under local anesthesia. It's a very simple procedure. It takes about 15 minutes, and it's done, and it goes to a pathologist, a doctor that specializes in looking at tissue, and they serve as a referee, just like the black and white zebras on the football field. They say, yes, you have it, or no, you don't.
The Patient Advocate Foundation CEO and President, Nancy Davenport Ennis, personally became involved in legislative reform when a close friend, Cheryl, was not only battling cancer, but also her insurance company, which refused to cover her clinical trial treatments. While her friend Cheryl bravely fought for her life, Nancy, with help from the Virginia Task Force for Insurance Reform, worked on reforming coverage for cancer patients. In 1994, the task force was victorious with the passage of Virginia House Bill 240. But Nancy didn't stop there. She founded the Patient Advocate Foundation. All of these cases involve patients with chronic, life-threatening, or debilitating conditions. Some need help taking on their insurance company. Others have no insurance, while others have coverage but need financial assistance to buy medicine. None of these clients will ever have to pay for the help they receive from the Patient Advocate Foundation. And the foundation is able to successfully resolve more than 98% of the cases it takes on.
Well, when patients call PAF, oftentimes they have a myriad of issues that they're faced with. What they can expect from us is comprehensive, individualized services designed to help with their immediate need and also identify future needs that they may have as they move through illness back into good health. Our case managers are highly trained, they have diverse backgrounds, and when a patient calls our 1-800 number, they're immediately connected to a live case manager. The case manager does an initial assessment of their needs. We fill in an intake form where we capture all data necessary to work their case, and then that case is assigned out to a case manager based on area of specialty that will work with that patient from initial intake through full resolution.
When people call us, they're desperate. Every avenue available to them to solve the problem has not worked, and it's their life that they're fighting for. And at the end of the day, you're going to battle to save your life medically, but we don't want you to have to battle to save your life financially and to feel that you're losing all of your integrity and your hope because you can't get the financial issues solved or an insurance issue solved. We can do that for you.
It's very important that the people in this country realize this organization exists and that they know how to get to them, how to contact them, and get the help they need.
For more information, please visit us at www.patientadvocate.org or call us at 1-800-532-5274.
We have with us today Dr. James Powell.
Thank you very much for having me. Yes, I'm James Powell, and I'm a physician trained in clinical pharmacology and spent 25 years in the pharmaceutical industry and pharmaceutical medicine helping to develop drugs. And currently I am a principal investigator for Project Impact at the National Medical Association. This is increased minority participation and awareness of clinical trials. There's a program to help educate physicians about clinical research as well as consumers and why it's important for their participation.
So what is a clinical trial, Dr. Powell?
Well, a clinical trial is basically a systematic experiment or study in humans trying to evaluate any kind of product or intervention or some kind of change that really is seen as a possible method of diagnosis, preventing, or treating disease of human beings. A systematic process and just to evaluate what works and what is safe and effective for humans to use.
Now, why is it so important for African Americans to be in clinical trials?
The main reason is that when people take a medicine, they want to know that someone has done some work to be able to show that the medicine does work for them. And a clinical trial works. The way we do them is we include people with the disease to try to evaluate that intervention. And if there's not a diversity, if there's not minorities, if there's not African Americans a part of the trial, then it raises questions about whether or not the data that we collect in those trials really has relevance or will, in fact, provide meaning for how that product or therapy would work in African Americans. If we don't have African Americans in the trials, we really don't have what you would say proof that the product or the intervention will work for African Americans.
So why can't we as African Americans just use the medicine when it comes out and let someone else participate in trials? If they work for them, why won't it work for us just as well?
Not everybody responds the same to a medicine. There are a lot of reasons why we don't respond the same as genetic ancestry, lifestyle, environment, what kind of exposures we have, whether we've ever had problems like ulcers or liver disease or whatever in our lives, eating certain things over our lives. All of these things combine to create how we might respond to a particular drug or therapy. And so it's important that we have people like us in the clinical trials in order to know that the product will work for us. Otherwise, we may make assumptions when the product is given to us that, in fact, it's going to work. But if there's never been minorities or African Americans in the trials, there really is no proof. There's really no guarantee that that product is going to be as safe and effective and as beneficial to us as it might have been for the people that were part of that trial. That's why.
Now, we talked earlier in the program about the fact that sometimes drugs are tested, clinical trials, drugs are tested in Africa, Jamaica, and Brazil. Why is it that these drugs don't work on African Americans?
Well, the fact is they may work, but the problem is you still don't have proof that they will work. I mean, when I take a medicine, I want to be pretty sure that before I expose myself to any type of risk of a medication, that I have a reasonable chance that it's going to work. Now, if you've done the studies and work in places like Jamaica, Brazil, and other places, good for those folks, but when we come to America, our environment is quite different.
That's right, okay.
The same things. Our lifestyle is different. Our environmental exposures are different.
Exactly.
And so then our likely response to the medicine when we take them may be different. What we want to know and what we want to do is test them in our environment and in our people. And that way, that gives us the best chance when that physician gets that medicine and prescribes it for you. Prescribing it for people based on an understanding of their environment and what's likely to work for them.
So who actually does these clinical trials?
First of all, they're sponsored by a number of people. Largely, the biggest sponsors, of course, are pharmaceutical companies.
Pharmaceutical, right.
Other nonprofit associations and other groups that sponsor trials, and they're done by either academic institutions of a physician. A lot of times it's in the academic environment, but sometimes in the community, physicians in the community that will be involved in actually guiding the trial. The regulations and the law requires that a physician supervise the actual exposure of any kind of medication to people. And so those are folks that actually run the trials. Physicians or people that are delegated or overseen by a physician.
So the drug company. So what does it mean the drug companies want us to be guinea pigs? Isn't this what happened to the men in Tuskegee experiment?
Well, often when I'm talking to people around the country, people are concerned. They say, well, what you're asking me to do is be a guinea pig, and that is, in fact, not the case. The fact of the matter is, at one point in the history of African Americans, we really didn't have any rights to resist. But a lot of things have changed. The experiment at Tuskegee was an unfortunate event in our history that people, in fact, were put in a trial that didn't really have a protocol, and they didn't know what was going on, and they were the people that were running the trial told them some things that weren't right, and that was unfortunate. But
so this is not normal then?
That is not normal. That process is definitely not normal. What it is one of the things we learned over the years, and a lot of laws, a lot of regulations, and a lot of protections in place to help prevent anything like this ever happening again. You have to be informed that you are part of an experiment, part of a clinical trial before you can be entered into one. You have to give your consent.
Informed consent is what it's called, right?
Yeah, informed consent. And informed means just that. someone a paper and tell them read it. You have to really make sure they truly are informed.
Okay.
That they know what the risks are, what the potential benefits are, and know that they are in fact in a clinical trial. And also know that they have the right to withdraw from that trial at any time. Nobody can force you to be in a trial against your will, and that's one of the things that our regulations very vehemently protect.
So we've really evolved then when it comes to the dangers of participating in trials then, is what you're saying.
Oh yeah, we evolved quite a bit in terms of putting in place the laws and regulations and monitoring very closely what happens in clinical trials. Probably hear on the news some of the things that happened, not just to African Americans, but to a lot of people around the world with respect to being put into trials against their will or unknowingly, or things, other kind of experiments that were done on people without their consent.
Right.
That is not the way things happen anymore.
Not anymore.
There's a lot of laws, regulations, and rules in place to protect against that happening.
Okay.
Every drug that is available or that is used for the treatment of human beings has some
side effects.
Kind of side effects. But what you want to do is to have the drug with the most effective for the treatment of illness with the least amount of side effects.
That sounds,
Some of the old medicines will have, may be effective, but a lot of them will be associated with certain side effects. And you want to get rid of those as much as you possibly can.
Thank you so much, Dr. Powell. Project Impact, Dr. Powell, National Medical Association, thank you so very much, and we will definitely be talking to you again.
Oh, you're very welcome, and thank you for having me.
We want to thank our sponsors, Yum and the Susan G. Komen Foundation. Susan G. Komen for the Cure's Circle of Promise is a movement designed to further engage Black women around the globe in the fight against breast cancer. Join the Circle today at www.circleofpromise.org.
You can access our messages in several ways. Go to our website, www.africanamericanhealthmatters.com, and sign up to get tips on your cell phone, or you can join our new social networks, www.africanamericanhealthmatters.com/Facebook, africanamericanhealthmatters.com/Twitter, and africanamericanhealthmatters.com/MySpace.
And during 2011, you'll get more access through cyberstationusa.com.
Be sure to visit us on www.africanamericanhealthmatters.com or call 1-800-677-8441. That's 1-800-677-8441. And we want to thank Cyberstation USA for their vision and support of African American Health Matters.